The presentation was about prevention and treatment strategies in vascular cognitive impairment patients, so basically two fields. And for the first one, prevention, we outlined data coming from different studies showing that prevention of particularly control of vascular risk factors is effective in reducing the burden of dementia in our population. Particularly, I also focused on the new data from the Framingham study that showed very clearly that there is a decrease in incidence of dementia over time in the last 3 decades, at least in the US. And particularly, this holds true for vascular dementia patients. So my point and my opinion in that sense is that the control of vascular risk factors is something that has been able to reduce the burden of dementia over time and is effective, is ongoing. And there are different trials and population-based studies that show that indeed control of vascular risk factors is effective in reducing the burden of vascular dementia and of dementia in general. More delicate and probably more difficult is the field of the symptomatic treatment of patients with vascular dementia, patients who were already a severe condition characterized by cognitive problems that impact functional activity of daily living. Even in this field, although there are no licensed drugs for vascular dementia, differently from Alzheimer's disease, where we have a licensed drug for the symptomatic treatment of the disease. Differently from Alzheimer's disease, as I was saying, there are no licensed drugs in the field of vascular dementia. However, in my presentation, I show it very clearly that there are indeed some drugs that are effective in the treatment of these patients, even though they are not yet licensed. And also that there are many ongoing important trials in this field. So the main message from my presentation for what concerns the treatment of vascular dementia is that this field is not still, is moving, is advancing. I think that we are improving in this field, and we hope that in the near future we will have licensed drugs for the treatment of vascular dementia patients as well as we have for Alzheimer's disease patients.